I am pleased to report that we continue to see a decline in our overall case numbers. Over the last 24 hours, we identified 422 new cases of COVID-19 and completed about 8,300 tests. That puts our positivity rate at about 5.1%. This is a significant decline from the peak of our rolling 7-day average positivity on September 27th, when it was 11.3%. This decline in community cases is mirrored in the number of cases in schools. Currently, there are active alerts or outbreaks in 211 schools. Of these, only 10 schools had 10 or more COVID cases who attended within the last 14 days while infectious. The number of people in hospital for COVID-19 also continues to decrease. Currently, there are 608 people being treated for COVID-19 in hospital, 128 of whom are in the ICU. While we are headed in the right direction, I want to be clear that this is still a significant number of people in hospital, taxing our healthcare system. We must all continue to support efforts to bring these numbers down even further. And sadly, despite our declining case numbers, Albertans continue to die from this virus. In Alberta, the odds of being hospitalized with COVID-19 are approximately 8 times higher if you're only partially vaccinated, and 10 times higher if you're unvaccinated. I continue to urge every eligible Albertan to get fully vaccinated as soon as possible, no matter your age or health status. In addition to vaccines, we now have an additional tool to help prevent severe outcomes for those at the highest risk. Alberta Health Services has begun administering a new monoclonal antibody treatment for COVID-19 that was recently approved by Health Canada. Sotrovimab is a new drug that was developed specifically for treating patients with COVID-19 who have mild to moderate COVID-19 symptoms. It is the first treatment to be offered to outpatients in Alberta. For maximum effectiveness, it must be administered within 5 days from when the symptoms begin. But let me stress that sotrovimab is not a replacement for COVID-19 vaccines. Albertans are still strongly encouraged to be vaccinated against the virus, as vaccines are the most effective method to prevent the serious outcomes from the disease. Today, AHS's EMS mobile integrated health teams began administering sotrovimab to patients in their homes who are age 65 and older, are positive for COVID-19, unvaccinated, and who wish to have this treatment offered. Patients in Fort McMurray and surrounding areas will receive treatment in an AHS clinic. Some patients who have received a solid organ or stem cell transplant will also be eligible to receive this treatment regardless of their vaccination status. The treatment is being rolled out across the province in a phased approach, starting with those at the highest risk of severe outcomes like hospitalization. For more information on this program, please visit ahs.ca/COVIDopt. While this medication is helpful, it does not change the fact that vaccines continue to be our most important tool to protect both ourselves and others. Vaccines are safe and effective for everyone, including those who are pregnant, planning to become pregnant, or those who have recently given birth. I'd like to remind Albertans that beginning Monday, November 15th, Albertans' vaccine record must include the QR code in order to enter any business or venue taking part in the program. This means Alberta vaccination records without a QR code, including paper immunization records received at your vaccination appointment, will no longer be accepted. The exception to this is First Nations and military vaccination records, which will continue to be accepted. If you got your vaccine at an AHS clinic, a pharmacy, or a physician's office, in Alberta, getting your new QR code is quick and easy. You can visit alberta.ca/COVID-records to get your QR code and either save it to your phone or download it and print it off. If you need assistance accessing or printing your record, you can visit a participating registry office where they will print it off for you for free, or you can call 811 to have your QR code mailed to you. If you were recently vaccinated, it may take up to 2 weeks for your online records to be updated with the latest dose. If it's been longer than that, and there is a dose missing or there are other issues with your record, please visit alberta.ca/COVID records help for assistance.